Hello, my name is Alexis Alvarez. This is case study 1 for SPCE 638, section 802. The client overview for today, if I need to refer to this client by a term, we'll just call him W. He's male. Right now, he is 2 years, 11 months old. He's the youngest child of 3. He has a nuclear family, no exposure to preschool or any early intervention of any kind. His diagnosis is autism. There are no other diagnoses at this time. And the behaviors of concern are limited communication, delayed cognitive skills, low social interest, and repetitive behavior. So at this point, in his treatment, we have done a parent intake, which began with an interview asking the parent some questions, a general questionnaire of the client's abilities, their behaviors of concern, and then in addition, there is the questions about behavioral function for his throwing behavior as a part of his tantrum behavior. From his age and developmental level, we chose the VB map. The VB map is typically used for 0, but more typically 18 to 48 months. It covers domains like verbal operants, listener responding, motor imitations, matching to sample, receptive identification, reading, social, play, group skills, math, and writing. So with that assessment in mind, we assessed this client when he was 2 years and 8 months old. This assessment only lasted 1 hour, and so to prioritize the skills that we wanted to probe and assess, we chose as part of the VB map, the milestones grid, the barrier grid, the transition grid, and the early echoic skills assessment, or the ESA. We did not probe the intraverbal assessment grid, the self-care checklist, nor the task analysis and skills tracking chart, levels 1, 2, or 3. From his assessment, we scored him as a 34 on the VB map. Now, 170 is the max score, but remember that is developmentally for 4-year-olds. And while this client is nearing 3 years old now, he should typically have the majority of level 3 skills, but he only has 3/4 of level 1 skills at the time of his assessment. In addition, his barrier score was 26, 96 being the max score. A lower score is preferred in order that he adapt to different environments, different settings, different people, and he's able to follow directions, things like that. His transition score is a 10, 90 being the max score. Again, a lower score is preferred. And we'll discuss this more during his goal composition. And then finally, his ESA score was a 0. So typically at the age he was, nearing 3 years, he should have a score of 90. So this was definitely a goal that we wanted to pursue. Finally, as a part of his goal setting, we met with his parents and discussed where we should start. So as you can see, a lot of his goals are in the communication domain. So this is just to push his communication, the echoics, the tacting, the manding. Then for cognitive skills, we have receptive identification of reinforcing items in an array, things like his cup, his backpack, his favorite foods. And then also in cognitive domain, we have identical matching in an array. These are items that he sees every day, shoes, door, chair, stuff like that. In social domain, we wanted to lengthen the duration of his parallel play, and parallel play being defined as playing near other children, not necessarily with the same toy, but next to them. And then for adaptive domain, we wanted to work on his transitioning. So again, building the compliance with following verbal prompts and understanding that change is coming. And we wanted to lengthen the duration of his sitting during meal times. That is something that's important to them as a family. In addition, it will help to increase his tolerance to table work. For his motor domain, we inserted goals for gross motor imitation, fine motor imitation, and motor imitation with objects. In this way, he'll be able to imitate peers. And for behavior reduction, we have his tantrum behavior, which includes crying, falling to the floor, and throwing items. And the hypothesized function of the tantrum behavior is access to tangibles. So finally, with all of those goals set, we in the family decided to pursue ABA services. For this, it is a requirement for the family to be involved in weekly meetings to discuss the client's progress, his program, and any behaviors that we see increasing or decreasing, in addition to educating them about ABA, the strategies of ABA, strategies for generalization. Our goal as collaborators is to increase his therapy hours to full-time hours, and in doing so, we will train the technicians and coach them in order to continue to provide the best service that we can to this client. Thank you so much.